Ascites is a clinical manifestation of underlying liver disease, cirrhosis, cancer, hepatitis, congestive heart failure, hepatorenal syndrome, and even infection. And this ascites belly, which we see, this doesn't happen overnight. As liver function declines and portal hypertension increases, fluid begins to accumulate throughout the abdomen. It can be prevented in patients with early liver disease by staying active, participating in exercise, and eating a low-sodium diet, stopping smoking, and abstaining from alcohol. Heavy alcohol consumption was more prevalent in Hispanic males aged 18 to 25 years old than in any other racial or ethnic group. Hispanic men are twice as likely to develop liver disease than white men, and liver disease is one of the top 5 causes of death among Hispanic males. This may be linked to health belief patterns, including a fear of the unknown, a knowledge deficit on health-related matters, and the signs and symptoms to report to the healthcare provider, a general lack of trust in healthcare providers, with this patient population being more likely to seek advice of friends, family, and even the community before advice of a healthcare provider. Cost of treatments, follow-up visits, and lack of access to basic insurance also play a factor. Patients with ascites reported a decrease in libido and the ability to perform sexual intercourse, mobility and independence with ambulation and transfers, decreased intake of food and fluids, decreased ability to participate in and enjoy social interactions and holiday gatherings, and an increase in fatigue, pain, constipation, sleep-wake cycle disturbances, and emotional lability and upset. There's an increase in depression reported in a study out of Iran in 2020. And a 2022 study out of Iran showed that patients with ascites reported health-related quality of life outcomes over 80% lower than patients who did not have ascites. And this also affects the families too, with families experiencing anxiety and stress once their loved one with ascites develops encephalopathy, increased abdominal pain, and increased fatigue. All of the treatments for ascites are supportive, and they include diuretics, physical therapy, occupational therapy, TIPS procedure, paracenteses, and Pleurix catheter drain placement to remove fluid from the abdomen. But we as the nurses, we can be the real champion in providing early intervention through screening Hispanic males age 18 to 25 for their alcohol use, doing medication reconciliation and screening those lists for hepatotoxic medications, advocating with our providers to perform regular liver enzyme checks, scheduling follow-up appointments and referral appointments for our patients instead of just giving them a number to call later and make an appointment, partnering in a social worker for community-based referrals, and using medical interpreters whenever English is a second language. And then we can really partner with our communities in providing community-based screenings, education to the patients and families, and education on signs and symptoms of liver disease and worsening liver disease that requires immediate intervention, including emergent care. Thank you for taking the time to view my presentation. Here are my references where you can learn more.